Welcome back to another episode of the Stigma Podcast. I'm your host, Stephen Hayes, and today's guest is Sean McBride. He is the VP Partnerships at Lyra. He's been at Lyra for about 6 years, since I think he was, one of the first 2 or 3 employees there. And he's got a really cool story to tell about his personal experience with mental health, about how he found his way to Lyra. And, he has a lot of insights into value-based care payments and the healthcare system broadly from his time working in the White House, from, working at the Brookings Institute. So I'm really excited to share this conversation with you. Sean's also going to be a guest at the What If Fellowship next week, shortly before we air this episode, actually. And if you want to learn more about that program and how we help entrepreneurs and how we give them access to folks like Sean to be able to learn how to build businesses in the space, check that out in the show notes. There'll be a link. But without any further ado, I want to get to the conversation. Sean, it's really great to have you here. I've been looking forward to this conversation.
I'm honored to be chatting with you today, Stephen. Thanks for having me.
So I wanted to start by letting you maybe share a little bit about your background and how you found your way to Lyra, if you wouldn't mind.
It would be my pleasure. So my career really started focusing on public health and health policy. So I spent time working in international development. I ended up in Washington, D.C., working at the Brookings Institution on healthcare reform, and also spent a little bit of time at the White House on the National Economic Council. And I was at Brookings and the White House at a really, I think, interesting time in healthcare, where I was at Brookings at the lead up and the passage of the ACA, and then at the White House as the ACA was being implemented. And I really got passionate about the opportunity for systematic change in healthcare. And I felt like after the passage of the ACA, there was really an opportunity for entrepreneurship and to be able to build out sustainable ways that would focus healthcare on value and quality and getting patients better. And in my time at Brookings, I ended up helping build out a nonprofit organization that helped health systems and health plans start to change their payment models towards value-based payment models. And through that work of building out that nonprofit, it really gave me a personal and professional passion around trying to build nothing into something that creates value for others. So I ended up going back to graduate school to get an MBA and a master's in public policy. And through my own personal experience struggling with anxiety when I was in my 20s, mental health was always something that was top of mind for me. And I was chatting with colleagues and classmates and realized how common mental health conditions are, how my experience of struggling with a mental health condition in my 20s was not unique. And my experience of how hard it was to find care when I needed it was also not unique. And so that really kind of got my wheels turning and my gears turning. And I was fortunate enough through a former colleague, Dr. Bob Kocher, who's a co-founder of Lira, to get connected with David Eversman, our founder and CEO. And I was really taken with David's passion and intelligence. And I asked him if I could help him build Lira in any way that I could. And that was just when there was 2 or 3 of us. And so it's been fun to be part of this journey over the last 6 years.
That's amazing. And what was Lyra like in the early days? I mean, we, as a market, we as listeners to this podcast, we know of Lyra from the press releases. We know of the $1 billion valuations and raising a lot of money. But what was Lyra like in those early days when it was just 3 or 4 people?
The early days of Lyra were really focusing on where we could find a way of creating something scalable and sustainable to tackle the problems that we saw in behavioral health. So I think one of the interesting things to look back on even the really early days of Lyra is while our product and how we offer and we've learned so much along the way and how we do what we do, but the objective of the company has not changed at all. So when those early days, we really felt like there were 3 kind of big seminal problems that we wanted to tackle. The first was just how hard it is for people to find mental health care when they need it. When somebody's in that moment of courage and they're finally going to try to seek help for their depression or their substance abuse issues or their anxiety, we make it really hard for patients today. A lot of phone calls, a lot of logistics back and forth, and a lot of ambiguity around what you need for care. And so we wanted to make that process simpler. We also were really focused on the fact that it's just hard to find somebody who will see you. There's a structural problem with mental health networks in the US. And the third thing was really around the fact that it's confusing as a consumer, as a patient, but there's just no quality control that goes on in mental health. We rarely measure whether people are actually seeing symptom reduction and getting better with treatment. And so there was sort of little data, little understanding of what really worked effectively in mental health. And so we were very focused on trying to tackle the quality problem. And so it was a few people with those kind of ideas and that mission. And then it was really, how do we figure out who we can partner with to use technology and data and excellent, clinical service to try to make a difference.
And so in the partnership role there, you've been responsible for a lot of the growth and a lot of the customers joining and a lot of the people that Lyra's worked with. Who is the ideal partner or customer for Lyra? I mean, how do you guys go to market these days, and who are you looking to work with?
Our go-to-market strategy is primarily focused around finding employers and companies that are interested in offering Lyra as a benefit. And from our perspective, their employers and HR benefits teams are amazing partners for a few reasons. One, there's an incredible amount of scale you can get really quickly. We will work on, one partnership with an employer will open Lyra up to thousands or tens of thousands or hundreds of thousands of people that can now access our services. And there's a way of directly engaging them and communicating them and making them aware of our benefit through, communications from the HR team and to employees. The other big reason that we view employers and HR teams as really amazing partners is that businesses really have a vested interest in making the mental health system work better. Companies today are paying for networks with health plans. They're paying for EAPs. Maybe they're paying for apps, and they're not working. People aren't using them. There's little data to show that they're effective and getting better. And from a business perspective, if you're one paying for services that aren't working, that's frustrating. But it also means you have employees that are showing up at work every day, struggling with the common mental health conditions, from stress to depression to folks thinking about suicide. And I can tell you, as someone who struggled with anxiety and panic issues in my life, you are not contributing your best to work when you are really struggling with mental health conditions. You are not showing up at work engaged, collaborative, thinking and doing your best. And so employers really have a vested interest in fixing the system so that they're not paying for ineffective solutions, and they're really helping their workforce be their best. So that's really been our kind of go-to-market focus, of really shared value with employers and feeling like through partnerships with them, we can get a lot of scale to help a lot of people quickly.
One of the things you mentioned that I see a lot as an investor in this space is that there are these great solutions. They come to market, they're sold B2B, and people don't use them. And when I say people don't use them, I mean a pretty average market adoption rate inside of an employee base is like 3, 4, 5% usage. I mean, people really don't use these tools. How do you think about why that is, and how do we get people to use the tools that these companies are providing? Are we providing the wrong tools? Do people not want to be well? Is the stigma too intense? What's the thing that's keeping employees from using the tools that the employers are providing?
I think in healthcare, when you're thinking about something, whether you're B2B, B2C, that is a technology-only solution, and that requires somebody to kind of go outside of the norm of what they're used to, it's really hard to get people to engage. And so I could give kind of examples across healthcare, but if you look at mental health specifically, there are a lot of amazing, fully digital kind of app-based solutions for mental health. And when I say amazing, you can take them into a clinical trial, and the people that complete all of that digital content really get better. So they're effective tools. But when you look at the data, and even the published data and the studies, most people drop out. They don't stick with it. And when you take a step back and think about it, if you are depressed, you are by definition unmotivated. And working on your depression is really, really hard. So getting people to engage in an app, it's even a level, like a step up above like the typical social media platform, and figuring out creative ways to get people engaged. And, it's fun to go look at pictures and post videos and watch videos. It's not fun to work on your depression. And so I think the technology only plays in healthcare are really intriguing from a business perspective, because they're high margin, they're inherently incredibly scalable, but they're not meeting people where they're at. And so Lyra's approach has really been combining technology to enhance and expand the capabilities of expert clinicians and mental health providers. And there is a ton of demand and appetite for people to get support for mental health. I mean, you can't turn on the nightly news anymore and not see a therapist or a psychiatrist talking about, COVID's impact on mental health. And so people are looking for help, but they want help in the way that they're used to getting it. And so how can technology make it more convenient for people as opposed to trying to reorient people to think about things in a totally different way. And we've seen tremendous success with, I think, that combination of technology and expert clinical care. So for us, we're not looking when we partner with an employer to provide therapy to every single person at a company, right? I mean, if you look at the US population pre-pandemic, it was 20%. Now it's maybe 25 to 30% of people in a given year will struggle with a diagnosable mental health condition. So our mission is, how do we engage 20 to 30% of a population and get them into the right care? And our metrics with employers, we're typically engaging between 15 and 25% of members in the first year alone. So I think it really speaks to the demand for accessing mental health services if they're enabled and structured in the right way.
Do you have any insights, or are you willing to share, and it's okay if you're not, the sort of acuity level of some of those people that engage? I mean, are most of the employees at a large company that use Lira engaging because they're already well wanting to perform better? Or are people who we would consider more high acuity leveraging the platform as well?
We really are there for people across the spectrum of need. And I think it's a really great question, Stephen, because I find the phrase, the label mental health to be hard. Because to your point, we have people that reach out to us who are just overwhelmed or burnt out at work. We have people reaching out to us who are struggling with moderate anxiety or depression. And we have people, about 5% of the people who reach out to Lyra are actively suicidal when they reach out to us. So we really see the full spectrum of mental health needs. And we've really tried to build a solution that is there for that full set of needs. So we have digital tools that are supported by a coach at Lyra to try to drive adherence and engagement based on what we just talked about. We have full-on kind of stress and relationship coaching programs for people who are kind of in the mild to moderate bucket. And then we have therapy and licensed therapists and physicians who can prescribe medication for folks who are struggling with more moderate to severe issues. And I think one of the interesting things of the pandemic has not only been that there's more need for more people for mental health needs, but the average severity that somebody starts when they start care with Lyra has gone up on the PHQ-9, GAD-7, or Audit-C by about 20%. So the average person starting care with Lyra since last March is now really struggling with more, moderate to severe depression, anxiety, and substance abuse issues than we saw before the pandemic.
And back before the Americans with Disabilities Act, I read this in a book called American Psychosis. So I'm not an expert here, but I'm going to try to ask this question because it's interesting to me. It was okay for an employer to find out that somebody was seeking psychiatric help or getting help for their mental health and fire that person. But one of the questions that comes up for me when I'm talking to corporations about providing benefits like this is, how does the individual who needs help feel safe that they're not going to be treated differently at work because they're asking for help around something like suicide or substance use disorder or some other issue, or maybe asking on behalf of someone else? How is the person protected when they ask for help within the platform?
Well, legally, they are protected. So we make sure to try to communicate that through the platform that we're not going to share, this information other than in a aggregated, de-identified way to let your employer how many people used it and are people on average getting better, but nothing identifiable will be shared with their employer. So we really try to communicate that. We try to do a few other things to kind of help reinforce that if somebody engages Lyra. So for example, when you come and reach out to Lyra, for most people, you can always call us, but most people go through our digital kind of online assessment to get triaged to the right care to start. And we encourage people to register with a personal email. We get a lot of companies that initially are kind of focused on, well, maybe we could SSO out from our benefits platform. And that means that, folks are going to have to use their work email to get correspondence about their mental health treatment. And we have found that if you encourage people to use their personal email, you'll get much higher rates of engagement and adoption. The other big thing, though, is really, I think, on the HR benefits team. And we try to partner with companies really closely on this. But how much a company, and especially the leadership of that company, openly talks about the importance of mental health, that they want people who are in need to get care. If a leader shares their own personal story in their past about struggling with any mental health issue and how they engaged it, we will see Lyra's engagement rates skyrocket right after that leader shares their story. So I think there's a lot of things that companies can do to create a culture that is more obviously supportive of mental health needs. We do on-site therapy, pre-pandemic times, but for a lot of our employer partners. And that's another amazing way for a company to signal that this is something that they care about and want to support, that there's not stigma around it, if they're actually bringing, therapists into their office. So I think, there's both how Lyra tries to promote and communicate that it's a secure and confidential experience. And then there's also really working closely with the HR benefits team and company leadership to communicate that message and change the culture around mental health.
I want to shift gears a little bit and talk a little higher level about the mental health landscape. You had mentioned in your background and your story that you had personally struggled with anxiety, that you had a hard time finding help, and that's a common experience, which I think we all agree with. You had mentioned also that while at Brookings that you had worked on some value-based payment models, and I'm kind of curious, where are we as a healthcare system, as a mental health care system, in moving towards that? I mean, let me maybe start with, do you believe that we will ultimately move to a value-based system? And if so, where are we in that transition or that cycle?
I think we will get there. I think it's already taken more time than I would have hoped, and I think will take more time. And I think rightfully so, it'll move in incremental ways based on the areas where there's the easiest opportunity to, take inefficiency out of the system. So one of the interesting things about me going from having spent time at Brookings in the White House and thinking about ACOs and bundles and that kind of thing to Lira is most of the focus of moving to, capitated payments of some sort is really on trying to drive efficiency, to try to eliminate unnecessary services or get people to choose a more cost-effective and equally efficacious service. Mental health, outpatient mental health, I should say, is kind of funny in that the reality today is that 50% of people in America with a diagnosable mental health condition get no treatment. So it's not a part of the healthcare system where overutilization is the problem. Underutilization is actually the problem. So thinking about how you then try to adapt a value-based payment model to that reality is different than, creating a bundle for knee surgery and trying to make it as efficient as possible. So the majority of our providers right now are in largely fee-for-service type arrangements. Now, we do collect clinical outcomes data on our network, and we triage more patients to providers that are getting people better faster. And so we kind of use an overall network management approach to really focus on value. But we're increasingly working with providers where we will do things like giving them financial bonuses if one of their patients, gets a significant reduction on the PHQ-9 for depression, if that's what they're struggling with, or the GAD-7 for anxiety. And so we're increasingly experimenting with ways where how can we drive a model where providers who are consistently getting their patients measurably better are getting reimbursed in a different way for doing that. And I can't share the name of the employer, but are working with an employer, and it is a bundled model for therapy where there is a kind of initial payment to cover just the therapy visits. And then there's an additional bonus if the member actually gets measurably better in a big enough way on a validated assessment. So we're seeing, I think, some fun movement even in our employer partnerships and a desire for more value-based financial arrangements.
Have you been able to measure or quantify the impact of improved mental health on overall physical health and then correlate that to a reduction in physical healthcare spending, whether it's saving money to the insurance company that's providing physical health coverage or even to the employer who's paying for all of the healthcare? Have you been able to correlate that into the ROI conversation with customers of Lira?
We have, and it's you have to look at it in cohorts, right? Because everybody's going to be different. Certainly engaging an individual with multiple chronic physical conditions who's also depressed is going to be a huge cost saver if you can get that person into mental health care and actually have them see symptom reduction and get better. So there's lots of evidence that people with diabetes are going to be 4 to 5 times as expensive if they're depressed than if they're diabetic and not depressed. So there's a big opportunity there. Given that we work with employer populations, there's a pretty wide range of people who use our services. And so the employers we work with feel really strongly that, a 28-year-old who's working at their organization, if they're depressed, maybe, that individual is probably not using the physical health system much as it is, just given where they are in their life. But it doesn't mean that there's not a huge value and ROI story to be created by helping that person address and manage their depression. And so the big areas that we look at with Lira, when an employer is building a business case with us is one around how much we're reducing overall medical claims, but specifically focused on behavioral health needs. So are we helping people get care earlier that prevents somebody with depression, letting that depression get to a point where they need to be hospitalized because they thought about taking their own life? And so we can really see a meaningful reduction in high cost claimants' use of expensive care settings for behavioral health. We also, and we're working on a peer-reviewed paper on this, have used the eligibility files that employers send us to really be able to find fascinating information around retention. So we see that employees who use Lira are considerably more likely to stick with the company over the next 12 to 24 months compared to employees that get therapy, for example, through the health plan, even though the diagnosis and the demographics are, controlled for in both settings. So you can really see getting effective mental health care that reduces your symptoms actually leads people to stick with their jobs longer, to get more promotions, to be happier at work, which is a big cost saver for employers. There's also third-party assessments that we use around productivity. How much is somebody being distracted at work from their depression, or if a child of theirs is struggling, how much time are they spending trying to get that person into care? And we can measure that productivity impact. And we're actually increasingly seeing employers try to use standardized productivity assessments across all of their benefits and build that into the ROI case, that they have with leadership. And that really starts with kind of getting the C-suite on board with the measures that you're using to look at things like productivity, and then really being consistent in how you use that across programs.
It sounds like it's pretty clear that people who work for a company that are taking care of their mental health and using the Lyra platform are more productive, they are more effective, they're more engaged. That seems like that connection is pretty clear. Am I right?
Absolutely.
Is there any way, this may not be a popular question, but is there any way that you could ever screen when you're hiring people to find out, is this a person that's willing to take care of their mental health? And if so, they might be a better employee. And what I mean by that is that, the person may not have the right logo on their resume from the right undergrad or MBA school, but maybe they've been to rehab, and maybe they go to a 12-step program every day, or maybe they're really engaged with their mental health. And like that could really be a positive signal, even though they might not have the resume that compares to the other person that's considered for the job.
Stephen, I don't know about screening somebody at the employment level, but when I think about what I experienced when I ended up, after a long journey, seeing a therapist that was using cognitive behavioral therapy, I certainly had a 180, a life-changing impact on how I managed my anxiety and my panic issues. But I walked away from therapy just being like, the skills I learned in CBT are just things that every human, gets catastrophic thinking or is impulsive at times or doesn't manage stress well at times. And these CBT skills are just things that I remember thinking they should be taught in high school. These are just life skills that all of us should learn on how to manage our emotions and our behaviors. There's very few of us that are perfect in that regard. And it's one of the reasons that I'm really excited about really thinking about not only therapy for people who have a clinical need, but we have a mental health coaching program that clinical psychologists at Lyra developed, and we've now published peer-reviewed papers on it. And it's incredibly effective at teaching people those skills at a point in their life when things haven't gotten more severe or more significant. And I think we can really preempt a lot of more significant needs by getting people who, are just want to work on stress. Maybe it's just self-improvement, and teaching them some of these skills around resiliency or grit. Because, if you're in a job that is actually interesting for you, it's challenging and stressful by definition. Like, you don't want a job that has no stress because you would be bored. But how an employee handles that stress and manages that stress, I think, is hugely predictive on whether they're going to be successful. And I think getting more people in their life, even if they're not clinically depressed, to get exposure and training around some of the principles of evidence-based therapies like CBT would have a huge impact on our workforce and on society.
I agree with you. And one of my focuses at the podcast here and at the venture fund and everything I do is stigma reduction. And I believe that if we get more people engaging with CBT, more people engaging with resources like Lyra, even certainly people who aren't necessarily acutely in need of immediate care, you get more people talking about mental health. You get more people being open about seeking some kind of help to improve themselves, improve their performance, improve their mental health. And that stigma comes down and decreases. And then it becomes a positive signal to not only get help, but talk about getting help. And then you create this virtuous cycle where more people are willing to get help. Just like you said, when the leadership of a company comes out and talks about their mental health, people engage with the platform more. So I'm really kind of asking this from this perspective of stigma reduction and can we engage more people to do more with their mental health and then talk about it so that it becomes a positive signal versus it's only sick people that go get help.
I so agree, Stephen. And I know you've been a leader in this kind of area and talk about it a lot, which I think is really fantastic. That there's we've all bought in, not that we're all adherent to it and that it's easy, but that taking care of your physical health is important. We all know what you eat matters. If you exercise, these things really have a difference on your physical well-being. We need to get to a place as a society where we recognize that investing in your kind of mental well-being or your mental strength, if you will, is just as important. And there's certainly overlap there, right? I mean, there's a lot of research around physical exercise having a really positive impact on your mental health. But through my work with a therapist, through my work with a Lyra stress coach, there's practices that I've put in my life that are explicitly focused on trying to make sure that I'm investing in my mental well-being. And, they're, I think, starting to be more well-known things, but I start every morning by meditating and then by doing a gratitude list. And they can seem silly. I mean, if you ask my wife, they've had such an impact on how I respond to stressors, on my calmness during the day, on my happiness during the day. And I have no doubt that has enabled me to be a better employee at Lyra, as well as just a better colleague and friend.
Yeah. And I think there's this, how do I say it? When I look on my Instagram feed, I see some of my friends posting, images of them running an Ironman or lifting weights, or, they're bragging or promoting their physical health accomplishments. I want to see tweets and Instagram posts about people walking out of therapy having realized something that had baffled them for 30 years. That's where I want society to get to. I want it to be cool. Maybe that's the wrong word, but I want it to be cool to talk about improving your mental health. And it's still certainly very stigmatized now. And I think we see that in engagement rates. I think it's certainly cool to, I guess if there are in-person offices ever again, it's to sit around the water cooler and talk about, I ran a marathon this weekend, but who's going to walk in and say, man, I went to therapy yesterday and I cried for an hour and I figured out this thing that had been baffling me for 30 years.
When I first started, helped Lyra get started, and in the early days of talking to people externally, I would never share my personal story about struggling with panic attacks and anxiety. And I remember posting something about trying to fight stigma and then just feeling really hypocritical that I was posting about this, yet I wasn't sharing my own story. And I'd overcome it. Why was I feeling ashamed of talking about needing help at some point of my life and investing in that help and making progress? And one of the things that I find most special and most redeeming about the work I do at Lyra is I go to companies all across the United States and I start off typically in a first conversation with them, telling them my own journey about what I experienced, how hard it was, the impact that good mental health eventually made on my life. And the coolest thing about that is not that I'm sharing now, but how many leaders of companies, leaders of HR, leaders of benefits will share back with me their own story. And it just starts to normalize the conversation. And you just start to realize how, the stats aren't a lie. 1 in 2 people in their lifetime will struggle with a mental health condition, which means you will either struggle with one or you will for sure know people in your life that will have struggled with a mental health issue at some point in time. And so normalizing that conversation and embracing it and focusing on mental strength or wellness or whatever you want to call it, I agree, just feels like something that is, would make a huge societal difference. And we need to figure out, whether it's at work, at home, at schools, how to incorporate these principles into our lives.
Yeah, I agree with you. I love it. One of the things I do want to ask you about is around the startup space in the mental health world, because that's one of my big focuses. And it's, one of our large audiences here are entrepreneurs building in the space. As somebody who's been in this space for quite some time, you've seen it evolve. over the last 6 years or so. Where would you see the white space opportunity for aspiring entrepreneurs who are just starting out, wanting to do something to help people with their mental health? What's not been tackled from your perspective?
Well, I mean, there's a tremendous amount more to do. So I think one of the things that Lyra really started out focusing on is how do we make that experience of finding care better? How do we make it faster to access care? And how do we make sure that it's a good clinician? But I think there's a huge opportunity to continue. And this is where Lyra is really focused on how do we evolve the actual care itself? We're still, I think, at very much the nascent part of understanding what is effective in mental health care and what is not. And so are there different approaches to treatment than going, to therapy once a week and being on your own for the other 167 hours? Can we rethink that approach to treatment that helps people get better faster? So I think there's really thinking about the intersection of technology and clinical care and what that means for new care models could be really powerful. We think about IOPs, intensive outpatient treatment, for example. That is another thing that really is disruptive to somebody's life if they need to go into an IOP program. Technology might make some of it more possible for people to kind of continue to be engaged, in their social life with, their family and that kind of thing. That's really important for recovery. I think there's a huge opportunity in thinking about how we care for individuals with more acute needs. So there is really troubling quality of a lot of substance abuse facilities, for example. Some substance abuse facilities are great, many are not, and they're really expensive for individuals, for companies, for society. So I think really thinking about what's new approaches to treatment, all underpinned by measuring the impact of symptom reduction with treatment. I think there's a lot of opportunity there to really reimagine what the actual care delivery experience in mental health looks like.
Yeah. I mean, look, I went to rehab for addiction and I had a couple of things working for me at that time. One, I had been fired from a job, so I had free time. And two, I had a family that was willing to pay for it. I think that those are both luxuries in a way that most people don't have. I don't think that you should have to be unemployed or lose your job or spend 2 months away from your family and your kids and your job just to get back to basics, get back to good, just to get well, just to stop, using substances in a way that aren't healthy for you. So I really agree with you. I think there's got to be ways to deliver care, especially for things like substance use disorder, where you don't have to spend 2 months in the desert and spend, an annual salary to go out there and get help.
Absolutely. So that I think is just a huge opportunity area that creates financial value for a lot of different parties and also will just, I think, measurably change for the positive a lot of people's lives.
Yeah, I agree with you. I also think it helps destigmatize getting care too, because, it's almost like when we go to rehab, I'm tucked away out in this ranch in this desert somewhere, and I'm not engaging with it with anyone in my life. Or when I come back, I guess I'm in their perspective, the people in my life's perspective, I'm magically well now, which is not the case, and they don't engage with me throughout my journey. And I think if people are in the community getting help while they're getting help, that actually reduces stigma because the community can watch them on their journey and watch them get well and maybe learn with them. So, nothing against rehab. Rehab saved my life, but you're right. There's a lot of facilities out there that are not on the up and up, and going away and spending that kind of money is not possible for everyone. There's got to be something better.
There's actually a lot of evidence that shows that, it's hard for people to not, when they're struggling with a substance abuse issue, to not be around social supports that are positive for them. And then also your point, Stephen, what is really predictive of whether, an intervention like rehab will be effective is whether somebody gets into outpatient care and kind of continues working on it once they're discharged. And right now, too often you get discharged and you're on your own. It's like, to your point, social support seems you're magically better. You're not in care anymore. And then it's like a big investment of somebody's time, resources, energy that has a pretty low probability of being effective, where if we did have a better kind of continuity of care plan for somebody, it could be hugely impactful. So that is a big area that I think there's more opportunity. The other thing for a starting entrepreneur, I think some companies are doing this, so it's not like it's totally greenfield, but we have a strategic partnership with Calm. And I think there's just more opportunity to work on and enable what you and I were just talking about around just sort of mental strength or wellness or resiliency. How do we help build good mental health practices into somebody's just daily life regardless if they're at a moment of need? How do we just kind of keep people strengthening that muscle? I think like meditating every day is a great step. And you see, really innovative companies like Calm finding ways to help build into your meditation a gratitude practice and these other things. But I think there's more to be done in that area too, for sure.
Yeah, I agree with you. And I think that not only does that help people, it destigmatizes what mental health is. And, I make this comment a lot, and some people look at me funny when I say it, but there's 8 billion people on the planet. Everyone has a brain. Everyone has mental health. And far more of those people do something about their physical health intentionally than they do about their mental health. And that absolutely has to change. And that's really ultimately the goal of everything we're doing, is to get people talking about it, to get people thinking about it, to get people proactive about it, and to make it something that's just as normal as going to the gym.
Amen.
Well, look, man, I really enjoyed this chat. I'm really grateful that you spent the time to talk to us about your background, that you shared with us about your personal experience. Grateful that you shared with our audience a little bit more about Lyra. And I'm thankful for what you guys are doing. I really enjoyed this conversation. I really enjoyed getting to talk about the space from a high level and where things could go. And, look, I think what you guys are doing is amazing. I did want to give you a chance. If there's a way for people to reach out to you, maybe it's entrepreneurs that want to find a way to partner, maybe it's potential customers for Lyra. What's the best way to get in touch with you?
My email is Sean, SEAN, at lyrahealth.com. So welcome outreach. And Stephen, thank you again for having me. Like you said, and for any of the entrepreneurs or folks that are passionate about mental health, it's just, I think, a sea change from even 10, 20 years ago, that we're all talking about this. We're all actively engaging on it. I think it is a societal important issue. So I really appreciate all the pioneering work, Stephen, that you've done to really help push this across society and make it a topic of conversation.
That's kind of you, man. Thank you for saying that. And thank you again for your time. I really enjoyed it.
Have a great day, Stephen, and a nice weekend.
I want to say another special thank you, Sean, for coming on. I really enjoyed this conversation. I think that it's certainly educational that people learn about Lyra. I think it's helpful for entrepreneurs to learn about Lyra. I think it's helpful for potential customers and corporations to learn about you guys and what's going on in the space. But I also really enjoy having these high-level conversations about value-based payments and structural problems in the mental health network in America, and how people can deliver care that's going to help millions of folks and not just one-to-one care, and how we reduce stigma. So I really enjoyed the high-level conversation that we had. I think that conversation is also really educational. I think it's really destigmatizing, and so it needs to be had, and that's really one of our goals here. So thank you for engaging in that with us. To our listeners, I hope you found this helpful. If you'd like to engage with us, you can find us on Twitter at StigmaCast. You can find us on Instagram. You can email us info@stigmapodcast.com. And until next time, stay safe, be well, and thank you for your support.